And experts urge the government to wait until COVID-19 transmission further slows before relaxing quarantine classifications in Metro Manila. They note that while the virus reproduction rate is going down, hospital occupancy remains high. Will current measures really be enough to keep the coronavirus at bay amid the spread of more transmissible variants? Let's now go above and beyond the headlines with World Health Organization Country Representative Dr. Rabindra Abeyasinghe. Thank you so much for joining us, Doctor. We would like to hear it once and for all from the World Health Organization to confirm, has there been a local transmission, Doctor, of COVID variants in the Philippines?
Thank you, Rico, and good to be with you in the evening today. Yes, we do know that there are circulating in the NCR region and in some regions outside of the NCR bubble the variants of concern. We are particularly concerned about the presence of the B117, or what is known as the UK variant, and the B1351 variant, or the South African variant. We've also had a couple of cases of the PE1 variant, or the Brazilian variant, confirmed in returning overseas Filipinos in the country. So we are concerned about the circulation of variants. We have seen evidence over the weeks of increasing numbers of confirmed variants within the NCR, and this points to transmission within communities of these variants.
And on the Philippines' response to COVID-19, Doctor, are the country's current health protocols enough to fight COVID-19, or is there a need to make changes? Should we remain in MECQ, tighten once again to ECQ, or shift to GCQ?
So, Rico, the protocols we have in place appear to be adequate when we were dealing with the wild type SARS-CoV virus. With the advent of the variants and these variants being transmitted, we are not seeing only an increase in the Philippines, but we are seeing similar increases in many other countries that experience these variants being transmitted. And it appears that many factors are contributing to this increased level of transmission, in addition to increased transmissibility of the variants. So Philippines, what was good is that they restricted movements by enacting the enhanced community quarantine. We saw that in the last week of March, and as a result of that, as reported in your earlier segment, we have now seen a gradual reduction in the number of cases being reported on a daily basis. But the positivity rate for NCR remains relatively high, just below the 20% of samples tested, and a large number of cases continuing to be reported on a daily basis. Sure, it's less than what we had a couple of weeks ago. The congestion in the healthcare facilities, which prompted WHO to announce that we are concerned with the evolving situation, remains the same, because in many places within the NCR, health facilities are no longer able to accept and care for patients. And we know from our experience in dealing with this virus that people who will require intensive care and who will develop severe disease will progress to that state several days or at least a couple of weeks.
Yes.
Set of the infection. So although the transmission rates seem to be dropping now, we need to see the pressure on the healthcare system at its current levels, or even in fact potentially likely increase over the next few days.
So, Doctor,
yes.
As the positivity rate remains high, particularly here in Metro Manila, more than 1 million Filipinos have already been immunized. 480,000 of them have already received the first dose of AstraZeneca. So those close to 480,000 Filipinos who have received their first dose would now like to find out, when will the next batch of AstraZeneca vaccines arrive from the COVAX initiative?
Thank you, Rizwan. This is an important question. As you know, the booster dose for AstraZeneca is recommended 8 to 12 weeks after the first dose. And we expect, yet we do believe that the COVAX facility will continue and make good on its promise to deliver vaccines within the next 1 month. So the 12-week period will be only up in June, and we are confident that we will receive adequate vaccines to cover the second dose and beyond within the next month.
And what other vaccines, Doctor, can we expect from the COVAX initiative apart from AstraZeneca?
What we have now, we are in some advanced negotiations with the COVAX facility, and we believe that there will be, you may recall that there was initially a planned shipment of Pfizer vaccines. So we are now optimistic that there will be some delivery of Pfizer vaccines in the near future, and then that will be followed by planned deliveries of AstraZeneca vaccines. The quantities we cannot confirm at this point of time, nor can we confirm the exact dates. But once we have this information, we will share it with the government.
The WHO has mentioned about vaccine equity, and there has been an issue on this front where more vaccines are delivered to high or upper middle income countries vis-a-vis their low income peers. Is this why, Dr. Abeyasinghe, we are experiencing the slow deliveries of the AstraZenecas and the Pfizers into the country?
It's a complex situation, Rico. It's not only that reason. We are also seeing increasing demand for vaccines from vaccine-producing countries that are also experiencing this current surge of cases. And several of those countries have placed restrictions on vaccine exports with a view to protecting their population. So while that is an understandable situation, we also see a situation where the equitable distribution of vaccines is not happening, and a large, almost 80% of vaccines that have been produced and have been distributed to upper middle income or rich countries. So,
Doctor,
yes.
Because of the slow arrival of the vaccines and the vaccination drive in the Philippines has been quite slow. A lot of Filipinos are looking for alternative ways to protect themselves from COVID-19. And one of the alternative medications has been ivermectin. What is your take on the Philippine FDA granting hospitals compassionate special permits to use ivermectin versus COVID-19?
Frankly, Rico, there is no evidence of the efficacy of ivermectin in preventing COVID-19 infection or in reducing the severity of COVID-19 infection. WHO announced a few weeks ago that we need to look at clinical trials to actually determine whether this product is efficacious in any of these situations. It is understandable that people are worried and are looking to protect themselves, and they are happy to try anything. But we need to recognize that we shouldn't create undue hope and expectation when the evidence does not support that.
Right.
We saw a similar situation early on in the pandemic when there was a lot of hope and hydroxychloroquine was suggested as a magic cure. We subsequently saw through the solidarity trials that there was no impact of hydroxychloroquine. So we need to make room for the researchers and the clinicians to evaluate a product and conclude. We need to recognize that 90% of COVID-19 patients would not need hospitalization and would recover on their own. And if people have been taking substances, they tend to attribute it to this or the other substance. That doesn't necessarily mean that that substance is effective in protecting somebody, because they would anyway recover. And so we need to clear this out and be very clear on what is actual efficacy so that we can conclude. And that is why we are asking to give room for clinical trials so that we can assess that efficacy.
Thank you so much for joining us on CNN Philippines Newsnight. Rabindra Abeyasinghe, World Health Organization country representative. And straight ahead.